our philosophy here in research is the research questions come from the clinic. That's really what it is. Almost every, if not every, research question we've done here came from the clinic, from seeing a patient or listening to a patient's story. I tell my patient, I say, you're our best teachers, because really they teach us about this disease. They're the one who have the disease. They're the one who live with the disease. They're the one who knows the disease well, and they're able to tell us exactly what they're feeling and what their story. And then when we listen, we're able to be analytical about listening, right? Then we try to find commonalities between the stories. And that triggers us to say, okay, we have to go after this research question because we're keeping hearing it from different people. So that must be something not by chance. And now we have to go to the next level in how we discover how is this happening and what is going to be the next question we're going to ask for research. That's how we do it. The developments in the field of multiple sclerosis is very much rapid. I can go and talk about what I'm really excited about. But what we tell people, we say that the treatment of MS have developed in a way that we have now very effective treatments. What we know is we know that early diagnosis and early treatment matters. People who are diagnosed today with MS, they're doing much better than people who were diagnosed 10 years ago or 20 years ago, because now we're diagnosing them earlier. We're putting them on highly effective treatments early, and then we're literally shutting down the inflammatory activity in MS. But what I tell my patient, I say the future is a little different. I say now we became so good into suppressing the immune system, we're able to control this collateral damage I talked about. But I think the future holds that we will be targeting disease-causing mechanisms. And that's where most my excitement is about, is can we detect the multitude of factors that are contributing to the disease causing, whether it's EBV, like Epstein-Barr virus, whether it's a toxin in the environment of some metal or something, right? Can we, instead of just using an immune modulator and immune suppressant, can we combine that with an antiviral? Can we combine it with maybe a chelating agent of some sort if we think there's any metal exposure or anything like this that we can prove, maybe? Can we do this combination therapy and then offer patients not only a one treatment approach, we offer them a multi-dimensional treatment, which we call it, maybe the multiple sclerosis cocktail of treatment, like we give them like a mix of things. And then maybe we will be able to arrest the disease instead of just slowing it down. The other thing I tell my patients I'm very excited about is repair. All the treatments we have, they're trying to prevent future damage. But there is damage happen already. The immune system already damaged neurons, already attacked, right? So can we have this remyelination of the neurons? Can we have neuron form new myelin? We know how to measure it in a way. Now it's a matter of let's try things. Let's try what are the things that could improve remyelination. So I tell my patient the future is this way. The future is going to be using highly effective therapy safely. And we want to use multiple approaches to tackle the disease, not only just the immune modulation. So I think more research needs to be done in this, but this is what I'm really excited about. The patient asks me, I'm in a wheelchair, will I walk one day? I cannot say no. I don't know. Maybe they will, right? I think that there's a hope still into something that may be coming as a breakthrough in this field. I think people are really very much focused on it. People are doing lots of research with lots of resources, and these efforts are global efforts. Everyone is working together. They want to advance the field. They want to discover the next molecule. They want to discover what's causing the disease. They want to really work hard to improve the lives of people living with MS. So that's really what we all share as a vision. And, we have the resources to do that. We have the talented team to do that, which I think always very important. We want people to go to neurology. We want people to specialize in MS. And, I'm a little selfish here, but I want people to be in that field because this is how we drive innovation. We want very talented people to go into this field, hardworking people who are able to identify what people need and then work on it. Someday, MS will be just in the history books, right? That's really what we want to see.